Hello everyone, this is Alicia Sweeney and welcome to my presentation When Time Matters Most. This is a multidisciplinary clinical approach to effective treatment of stroke patients with an increased nursing collaboration. Recently, Medicare has changed its payer guidelines with the implementation of Patient-Driven Payment Model, or PDPM. With this change, treatment times have been decreased and payment is now heavily reliant on functional-based outcomes. So what does this mean for skilled nursing facilities? Well, now therapy sessions must become more efficient and functional for each patient. With the decrease in therapy time allotted per patient, we are now increasing the utilization of multidisciplinary approaches. This means that the nursing staff members must also become more proactive with patient rehabilitation. For a specific population commonly found in skilled nursing facilities, the stroke population, research has proven that patients, specifically stroke patients, have much greater functional outcomes with increased implementation of therapeutic activities. The article titled Time Use of Stroke Patients with Stroke Admitted for Rehabilitation in Skilled Nursing Facilities addresses this issue further and in more detail. This descriptive observational study, published in 2013, assesses 5 Dutch skilled nursing facilities and the time spent on therapeutic activities within each. Of the total 45 patients meeting this inclusion criteria, 42 participated in the study. The mean age of the patients were 76 years old, 57% were female, and 43% male. The mean Barthel Index score was 11.8, which indicates a moderate dependence. When taking a look at the breakdown of the statistical data, we can see that 56.1% of the day was spent participating in therapeutic activities versus 43% and 50% on non-therapeutic and social interactions, respectively. When assessing the breakdown of therapeutic activities, it is important to note that the average time spent in physical therapy was approximately 22.9 minutes, which is only 4.4% of the day compared to 8.6% of the day spent in nursing care. Nursing staff spend more than double the time with stroke patients than the rehab staff. This article concludes further that the time used on therapeutic activities was positively associated with functional status. You would assume that the patients who had lower functional status scores would spend more time in therapy and practicing therapeutic activities, but this study found the opposite to be true. And in fact, patients who were severely dependent spent 45% of the day completing therapeutic activities versus those who were totally independent spent 63% of the day completing therapeutic activities. You may be wondering, well, what does this have to do with nursing staff members? From the study, it is clear that elderly stroke patients spent more than half the day on therapeutic activities in skilled nursing facilities, and that most of this time was spent under nursing care. So how can physical therapy clinicians encourage greater amounts of therapeutic activity with decreased patient treatment times? We can work together and educate you on techniques to further increase the functional outcomes of stroke patients. To further enhance functional outcomes for stroke patients, the rehabilitation team and nursing team can collaborate and we can utilize each other's skills to increase function with decreased therapy time. The rehab staff can teach you and educate you on function-based interventions and correct mechanics of these task-specific interventions. We can share roles and functional activity practice, such as frequent transfers, so that the therapy staff can spend more time on patient-specific interventions during a therapy session. As nursing staff, you can assist the rehab team by encouraging caregiver involvement in care. You can also help determine the tasks that are patient-specific and gather the best sources of motivation for the patients during your time spent with them. And last but not least, the nursing staff can most certainly facilitate interventions created by the rehab team if you find yourself lost for ideas on things to do with these patients. Together, we can make the most out of less time for our patients.